and welcome to the Maternal Mental Health Report podcast, where transforming maternal care starts with empowering those who provide it. I'm your host, Jessica Walker. I also go by Joss Speaks Digital, and today's episode is one for the books. Today, we're talking all about empowering voices and improving care, the impact of the Embrace study. And I have a special guest. Her name is Shanell Williams. She is the principal investigator for the PCARI-funded Building Stakeholder Capacity for the Embrace Study Community Dissemination Initiative and director of community engagement for the California Preterm Birth Initiative at UCSF. We explore the Embrace Prenatal Care Study, a groundbreaking initiative that's redefining how we approach maternal mental health care.
Yes, thank you so much, Jessica, for having me on the show. I'm really excited. So we were able to get funding from PCORI, which is the Patient-Centered Outcomes Research Institute. This happened about 2 years ago, where they have a call for building capacity with stakeholders. And so the Embrace study is conducting research, and the program that I'm the principal investigator for is really situated to invest in stakeholders like Black moms and building their capacity to share information from that study. So our project is focused on that, building patient representatives' capacity to be able to disseminate what we learned from the Embrace study.
Okay, so tell me a little bit, what inspired you to focus on maternal mental health and innovative care models like those in the Embrace study?
Yeah, so we know that mental health is something that many moms struggle with while they're going through their journey. And this is such a critical issue. And I think that it's getting more and more attention today, and which I'm really happy to see. I would love to, Jessica, if I could walk through some of the study information as well as information about the Community Dissemination Initiative, if that's okay.
Absolutely. That was my next question. So great segue.
The Embrace Community Dissemination Initiative. And what you see here is a list of our dissemination team. Our dissemination team includes moms who were once part of the Embrace study and that decided to join us and build their capacity to be ambassadors to help raise awareness of the findings of the Embrace study. And so you see their names here along with my name as the principal investigator. So this is an amazing quote from Dr. Joya Career Perry. She's a national leader and with the National Birth Equity Collaborative. And she says, racism is a public health crisis. The data are clear. Black women and their babies are dying at rates that are unacceptable. It's time for us to change the narrative around Black maternal health, which is so critical. So a little bit about the Embrace study. The Embrace study is a comparative effectiveness study. So it's comparing the enhanced individual prenatal care, individual care with CPSP services versus the enhanced group prenatal care of GLOW. There were 675 low-income, primarily Latinx pregnant people in Fresno who participated. The participants were recruited through clinics in Fresno and the surrounding counties. And the goal of the study was to determine which of the two models is more effective in improving mental health, depression, and anxiety, and the patient experience of care, patient-centered care, and patient satisfaction, as well as preterm birth. So the Embrace study also has a qualitative aim, which is led by Dr. Brittany Chambers, who is at UC Davis, and she's exploring the experience of representative participants in a more nuanced and in-depth way. And data collection was excitingly completed in November of last year, and now the team is really focused on data analysis, and those results will be coming out later this year. So for the project that I'm the principal investigator of, the Embrace Community Dissemination Initiative, we have these objectives. Really, it's about disseminating the knowledge and prenatal care disparities that we've identified with Black women and birthing people. We have these three goals, the first of them being community engagement, building out a community engagement and dissemination plan. We secondly want to build the capacity of the stakeholder advisory group to the Embrace study. And then where we're at now is that we're piloting and evaluating our dissemination strategies, like what I'm doing here today. These are our three pillars. First one is education and training. We want to strengthen the knowledge and build the skills of the patient representatives, which are Black moms who are from Fresno and the surrounding counties. We want to build community awareness of these issues, particularly preterm birth. And we want to disseminate, we're going to work towards, improving care through strategic dissemination strategies. In addition to our pillars, we have these three outcomes. We want increased capacity of Black patient representatives. We want stronger community involvement in the dissemination process. And we want development of outreach and dissemination tools. This is all part of this work. So here's our timeline. We started, like I mentioned, a few years back in December of 2022. And through November of 2023, we were able to recruit the 7 patient representatives that we have with us today. And then also we have a communications trainer and consultant that worked with the patient representatives and provided support and training. And from December 2023 to August 2024, they were engaged in communications training. September to November of 2024, we were piloting and putting out our communication strategies. And right now we're continuing that piloting of our dissemination activities. So here are our patient representatives. They are an amazing group of women who have, like I mentioned, were involved in the Embrace study and that have chose to become leaders and really represent the findings and get those findings out in community. They advised us on all of our communication strategies, whether they would be culturally relevant and really speak to the population that we're trying to reach. And you also see our communications trainer and consultant, Kimmy Amin, and myself as the principal investigator. So we have Alexandra Ben, Deanna Briggs, Jamie Brown, Jada Lee, Tashi Ray Manning, Constance McMichaels, Francesca Mitchell Quattlebaum, and Legine Simeon. Here's the training modules that the representatives went through. They first started with what is communications, and then leading into learning about branding, learning about communication analytics, presentation design, and public speaking. They also learned about building out the communications plan as well as the dissemination plan overview. They also got information on translating science and academic data. And lastly, what you don't see here, they got training on data collection methodologies, which is so wonderful. So we were hoping to be able to have the Embrace study findings during the time that we were engaging in this capacity building process. The Embrace study findings are going to wrap up later this year, but our project is actually sunsetting this month. And so we were able to identify some early findings from the Embrace study that we want to lift up as part of our dissemination work. And so we had a vote with the study advisory group, and they selected Dr. Brittany Chambers' paper for the pilot of the campaign. And her paper is focused on systemic racism on maternal health for Black women and birthing people. And so the name of her paper is Pregnant and Postpartum Black Women's Experience of Personal and Group-Based Racism During the COVID-19 Pandemic. And there were several insights from this paper, which I'll get into shortly. And so what was so great about this paper is that it highlights real life experiences that Black women and birthing people go through. And really it's lifting up what was happening during the COVID-19 pandemic and in partnership with like what was happening with George Floyd's murder. And during that time, we know that there was a lot happening with the COVID-19 pandemic, in addition to the anti-Black racism that we were seeing in our country. So we know that Black women are 3 to 4 times more likely to die during childbirth, and their babies are 2 to 3 times more likely to be born prematurely or die within their first year. And what we've seen based on Dr. Chambers' paper is that the COVID-19 pandemic worsened these outcomes. And so it really was looking at, like I mentioned, the intersection between racism and the pandemic and the unrest that was happening in our country at that time. So we'll now get into the findings. So some of the key findings was that there was a lot of tension around the Black Lives Matters movement. Participants in the study felt that it was great that all this attention was coming to the anti-Black racism and police violence in our country, but they also were worried about increased danger for the Black community. There was fear for Black moms, their sons' safety, and many participants voiced their concerns about raising Black sons in this society where we're seeing this police violence mostly targeted at Black men, particularly Black young men. So they talked also about healthcare racism. They shared experiences of disrespect, poor communication, and judgment from healthcare providers during their care. And there were assumptions often made about their social economic status, as well as their marital status, and about their ability to make personal decisions regarding their care. There was an emotional and physical toll during this time because there was collective trauma that we all were experiencing from the pandemic, as well as from the police violence and anti-Black racism that we were seeing. So participants noted feeling judged or not taken seriously by healthcare professionals, which hindered their ability to receive appropriate care. And in conclusion, Dr. Brittany Chambers' study really highlights that racism is a root cause of health disparities for Black women and birthing people. And the COVID-19 pandemic exacerbated these challenges in healthcare. And so these findings really emphasize that we need to have culturally sensitive care and we need to address structural racism in care. So we know that the pandemic is past us, but Black women are still having these experiences, and the healthcare system, it isn't fair, and Black women are often not getting the care that they need. So what can be done? There's three groups that we're hoping to speak to through this work. The first being Black women and birthing people, the second being healthcare providers, and the third being policymakers. And our amazing patient representatives, this is one of the tools that we were able to create with the patient reps. It's a pregnancy care guide for Fresno County. It starts with a love letter to mamas, really knowing that this journey that they're about to take is a really special journey, and really speaking to them and sharing that we're here for you. Just some words of encouragement. I really like that it's a love letter. And we walk through all the different trimesters in the pregnancy care guide, having, listing out questions that moms can ask during those different trimesters. It's really about empowering them and empower them to speak up and use their voice, which is so great. We also have questions for the postpartum period, and we have resources with a QR code that moms can use and access as part of this pregnancy care guide. And lastly, what I thought was so powerful that the patient representatives lifted up is the need for affirmations, because they spoke to sometimes when they go in for their appointments, the need to get pumped up and to get, energized and be able to speak up. And so how do we do that? We do that with affirmations, and we have some really great affirmations listed there, like I deserve to be heard and respected and supported throughout my pregnancy journey. I trust my instincts and knowledge about my body and will seek the care I deserve. I am worthy of compassion and culturally sensitive healthcare that honors my identity. And you see our reps are there as well. We also have tip sheets for Black women and birthing people, for healthcare providers and policymakers that we did in partnership with the patient reps. We have a website that has been launched. And lastly, we have social media, because we know social media is so powerful, where we have a number of different social media messages that can be put out, really talking about the Embrace study, but also talking about data points that we know as it relates to the experience of Black women and birthing people. There's some more social media. Got some cool videos. And these are all based on the three different audiences that we outlined: Black women and birthing people, policymakers, and healthcare providers. We have additional materials that we've made available through this process. And right now, we're essentially in the pilot phase. We're going to be wrapping up this work, and we've developed all these amazing materials, all these assets with the patient representatives that once the Embrace study sunsets and they have their findings ready to go, they're going to take all of this work and integrate that into the findings. So how folks can help, we really want folks to share out the pregnancy care guide. We want folks to repost on social media. We also encourage folks to vote and get involved in the civic process. So we'll end with a quote from Audre Lorde: "I am not free while any woman is unfree, even when her shackles are very different from my own." And we have many thank yous. Thank you to Fresno State and the Central Valley Health Policy Institute, to the University of California, San Francisco, to our funders, the Patient-Centered Outcomes Research Institute. We also want to thank the principal investigators of the Embrace study, Dr. Miriam Cooperman of University of California, San Francisco, Dr. Mary Garza of Fresno State University, and all of their teams. And we also want to thank the California Preterm Birth Initiative and First Five Fresno County. Thank you, thank you, thank you to everyone. This was a group effort, and it's just been such amazing to see all the work that's been done.
Great presentation. Now I do have a couple of different questions to kind of follow up. How did this all even come about? Where did it begin?
Yeah, so it really began with a conversation about the need to get more voices of Black women and Black birthing people into the Embrace work and the Embrace study, and to really honor those experience in a more substantial way. Because as you saw, we had a lot of representation from the Latinx community, but we really wanted to get the voices of Black women and birthing people. And so that's where it started. And then we had this opportunity with Pcori, and we said, well, why not apply to be able to do this work with a cohort of Black women and birthing people, and increasing their knowledge and skills and getting their voices to help us develop these communication tools and all of these assets for the study.
Yeah, I would love to hear some of the insight that you got back from some of the moms once they kind of finished. Did you all have like a graduation or?
Yeah, so we're still gonna, because we're wrapping up this month, so we are gonna still have our celebration of
Oh, you
everything.
haven't had it as of yet.
We
Oh,
haven't had it yet, but in the beginning, I feel like, and when I was doing the recruitment and connecting with all the moms, there
mhm.
was a lot of like, well, can I really do this? Am I
Yeah.
really like a representative?
Mhm.
I'm like, you guys are consultants. Your voice
Right.
really matters. You have lived experience. We need you to inform us. And so it was helping them to see that they have a voice and that their lived experience is really valuable. And just like any consultant, we respect them, and we want to hear from them and get their advice all along the way. That was something that was really intentional about this project.
Yeah, so I saw a lot around, and I love the affirmations. But can you talk a little bit more about how you integrated mental health into all of your study in this work?
Yeah, so in terms of like, I'll talk about, well, for the Embrace study, that was a key component of the study, really measuring depression and anxiety. So that was baked into the study, and that was a core part of what they're looking at for the Embrace study. For our project, Building Capacity for Dissemination, there was a lot that came out from the patient representatives about their own birth experiences. And I feel like there was sort of a sisterhood that was created in those spaces where folks would talk about and really openly share about their journey and how difficult their journey was at times. Also, going through some of the data, some of that data can be triggering to look at, right? Like looking at all those statistics and seeing those problems over and over again can kind of bring it back for folks. And so, really integrating, breathing exercises when we begin and get into our sessions, doing some pauses and checking in to see how folks are doing, but also just having that community of other women who have been through a similar journey, I think was really supportive for the patient representatives and really helped them to feel open about sharing.
Yeah, no, I love it. I love that. Our audience is primarily like home visitors, providers. What are some practical strategies from the Embrace study that you feel like they could implement in their own work?
Yeah, as part of so our three audiences for the dissemination is really, we do have healthcare providers as one of the audiences. And I think that, we heard a lot around training, looking at cultural bias, getting into some of that training. And it's a lot of work, really getting into the hospitals, getting into those clinic settings, working with even our social service providers, and getting that training. So I think that a big thing that came out is like, folks need training. Folks can work with community to learn what are some strategies that I can use when I'm engaging with this community. And I think that having community advisory boards is something that is so critical, that I've seen in my work at the California Preterm Birth Initiative. Hearing from our community advisory board really changed the trajectory of all the providers that we were working with, as well as the researchers. They would come and speak with the advisory board, and they had certain perceptions before they came and spoke to the board, and then had varying perceptions after. And folks were really candid and really candid about their reflections from what folks were sharing and saying, well, I don't think you should do that. Or, people were very straight up about like, hey, this ain't gonna work with my community, and just keep it real. So I think that folks do have to be open to that. We have amazing leaders in our community that can provide that information and support. It's just that, sometimes there is that tension, right? Where if a provider is like, hey, I'm doing the best I can, I'm already, stressed and my capacity is limited and not feeling, and sometimes folks can feel attacked. It's not about attacking anyone. It's really about like, hey, let's take a moment and hear from the community and see if there's adjustments that can be made. But we've seen it all. We've seen folks that are really excited to partner with community and get that feedback and get that training. And then there's also folks who, it's a struggle and we, want to figure out how to meet them where they're at as well.
Yeah, there's a couple of things that you talked about. I also wanted to touch on. We also held a focus group here in Sacramento. Across the board, we heard the same exact things from our moms that you all heard in your study. So it's kind of like at this point, what do you feel like needs to happen in order for these not the stories, but for this to change, right? The disrespect, the poor communication, the assumptions. What are some of the steps you think we could take to move, this forward so that we don't continue this same cycle over and over and over again?
Yeah, that's it's a big question, and it's a necessary question, and it's a question that I've, had for numerous years over the last 10 years doing this work with folks who are on the front lines. I think there's a carrot and there's a stick, option, right? So the carrot is like, hey, this will help, your care, your involvement will be better, right? The outcomes will be better, your work will be better, and things will be better, right? Because we want to believe that providers want to see good outcomes and they
Right.
want to be effective in their work. So really speaking to engaging with community, doing this training is really going to improve your experience as a
Yeah.
provider, right? So there's that carrot option, like, hey, this is the benefits. And
Right.
then there's the stick of like, can we implement some policies? Can we have some accountability measures in place across the board in these different spaces? And I know there's been folks who have done some of that work. I've heard of things like, like the Earth app where, people are rating and doing things like that and being able to say, this hospital or this clinic is a good space. For you to, have your care as a Black woman. And so I just think that there's both options. And like I said, not all providers are the same. We have some providers that may respond better to that stick option and that accountability option. And some providers who are like, hey, I want to do the best for my patients. I want to have it be effective and have these positive outcomes. So I think we have to do both because there's multiple types of providers that are out there.
Yeah, yeah. And so, if we're speaking to, and I know for the majority of the folks that listen to my podcast or that follow me or connect with me, they are in that caring space. They're in that space of, I just want to do what's right for my patient. What would you say would be the first step?
Yeah, I think the first step, I really, as a community engagement person, I'm always about like, how do we get folks with lived experience in the room and
Right.
hear directly from them? So I don't move without hearing from those that are directly impacted. I
Yeah.
think that is always key. And I think even the best of us sometimes can forget and we just want to move and
Right.
we're excited and we want to get things done and we're frustrated too, right? But how do we continuously have that voice at the table and make sure that folks are not just at the table, they're also getting those investments and their education and skill building and training so that they can engage in a way that's meaningful for them, because don't want to tokenize folks either.
Mhm.
We want to make sure that folks have the tools and the information they need to really participate in a way where it's a open and equal conversation.
Yeah, yeah. As far as the outcomes that you have for the Emerge study, what was some of the, or what would be your number one outcome that you would love to see happen out of this study?
Oh, um, I would really love for folks, once they see from the findings that group prenatal care and this enhance and all the different components that they brought in, the social support components, that they see that it works and that it provides some great a great impact for the community that it's implemented. that it is something that folks move towards bringing into their clinics, bringing into the hospital on a permanent basis, that there's resources to make that a reality. And of course, we want to get all the information out there and build awareness. I would just love to see this integrated into the health system.
Yeah. So integration into the health system is the number one outcome you'd love to see.
I would love to see that. I would really love, and I know that it's about the resources at times. I just also think
Right.
sometimes it's political will to do that. And we know that, Black moms bear the burden of these disparities across the board. So how do we even create special programs for Black moms like that really speak to some of what I experienced with the patient reps, having that community space, other moms who have been through similar journeys coming together and connecting with each other. It's so powerful. So I would love to see that integrated on a continual basis.
Yeah. No, I agree. I absolutely agree. So Shanell, we are coming up on the end of our time. Is there anything else you would like to say, or any other tips that you would like to give to our providers, our home visitors, folks who work with moms, in any capacity? Anything else you would like to say to them, or any tips that you would like to give them as we end?
Yeah, well, first I would like to say thank you. Thank you for the work that you do. Thank you for being an advocate. Thank you for showing up and being in partnership with moms and with folks who are directly impacted and listening to them. And I know that it can be difficult at times, and I get the pleasure, have the pleasure of working with doulas and midwives and so many a beautiful collective of folks who are on the front lines doing this good work. So I know that sometimes there can be impacts to those that are providing as well, and the things that they're seeing when they're going into these spaces and the support that they need as well, and doing this and being an advocate. So I just want to acknowledge that you need support too to continue in this fight. And please take care of yourself and know there's a community out here that is fighting with you. And thank you for all that you do.
Absolutely. I love that message. Shanell, thank you for your insights and dedication to advancing maternal mental health through the Embrace study. Your work is really inspiring. Oh my gosh. I'm so excited and happy that we were able to connect. And it offers some invaluable tools for providers and home visitors to better support families. Where can they find out more about the Embrace study? I know you mentioned social media, so feel free to also plug the social media handles as well.
Yes, so I will plug them. So you can visit us at the tinyurl.com/embrace resources, or you can even send an email to embrace@mail.fresnostate.edu. And yes, you can find all of our information on Embrace at our tiny URL.
Chanel shared a couple of different practical strategies for providers and home visitors. Providers are encouraged to actively listen to and incorporate feedback from Black mothers and birthing people to ensure culturally responsive care. Community partnerships and training programs can help providers better understand the unique challenges faced by marginalized communities. Using patient centered communication and advocacy tools developed by the Embrace study can enhance engagement and support Black mothers. Findings and challenges addressed. The study identifies significant challenges faced by Black women during the COVID-19 pandemic, including systemic racism in healthcare, disrespectful treatment, and assumptions about their socioeconomic status. Participants reported feeling judged, not taken seriously, and experiencing an emotional and physical toll due to the intersection of racism and the pandemic. The study emphasized the need for culturally sensitive care, improved provider communication, and addressing structural racism within healthcare systems. Some of the actionable solutions and next steps. Strategies proposed include creating community advisory boards, engaging providers in cultural bias training, and implementing policies that hold healthcare systems accountable. The study advocates for the integration of enhanced group prenatal care models into mainstream healthcare systems to improve outcomes for Black women and birthing people. In some of her final remarks, Shanell expressed gratitude to providers and home visitors for their dedication and encouraged them to take care of themselves while supporting their clients. Thank you for tuning in to today's episode. If you enjoyed this discussion, please share it with your network and leave a review. It helps us to reach more providers and home visitors. To learn more about the Embrace study or connect with Shanell, visit www.embraceprenatalcarestudy.org. If you have any questions, feedback, or ideas for future episodes, go ahead and leave us a note and we'll get right back to you. If you're watching us on YouTube, go ahead and leave us a comment down below. I try to respond to all of the comments that we receive from the podcast, and I definitely want to hear from you.